Welcome to Pain Awareness Month. Let's understand the pathophysiology of inflammatory disorders and pain. As components of the innate immune system, inflammatory mediators and immune cells help to protect against infection and potential damage to cells and tissues. In healthy patients, this inflammation may resolve, but if it is not remediated, acute inflammation can cause pain and discomfort in the near term that may transition into a low-grade inflammatory state with long-term consequences. Inflammation is a fundamental response mechanism. It's orchestrated by our immune system. It serves as a shield against potential harm, primarily infections and cellular damage. The intricate interplay of inflammatory mediators and immune cells help to keep our body safe. However, when this mechanism goes awry, it can lead to various health issues, including chronic pain. Acute inflammation is the body's immediate response to harmful stimuli. While it's essential for our survival, it can cause pain and discomfort in the short term. If not addressed promptly, acute inflammation may evolve into a persistent, low-grade state of inflammation that has long-term consequences. With biomarkers, we can track inflammation. Acute phase reactants as biomarkers provide a real-time assessment of a patient's inflammatory status. Clinicians use this data to apply precise interventions that expedite inflammation resolution and prevent it from progressing into a chronic inflammatory state. Chronic inflammation is a persistent long-term response to various internal and external triggers. It involves the continued accumulation of macrophages, lymphocytes, cytokines, and cellular debris. This ongoing inflammatory state is a physiological driver in many chronic conditions, including age-related ailments. Unchecked, chronic inflammation can trigger nociceptors, leading to unhealthy pain response across various tissues and potential cell tissue damage. What is a holistic approach to managing inflammation and pain? Well, to address the pathophysiology of inflammatory disorders and pain effectively, a holistic approach is essential. This clinical protocol focuses on supporting healthy inflammatory responses and promoting positive response to pain through lifestyle techniques, diet, and specific nutrients. What is a therapeutic diet and nutritional consideration? We'll opt for a whole foods approach, recommending a whole foods, anti-inflammatory, or Mediterranean diet. This is paramount. Such diets are rich in omega-3 fatty acids, anti-inflammatory herbs, spices, vegetables, and fruits. Choosing grass-fed, grass-finished meats and dairy over corn-fed options is crucial due to their higher fat ratios. Diets high in polyphenols, fiber, and antioxidants have been linked to lower levels of inflammation and oxidative stress in adults. You want to embrace fermented foods. We encourage the consumption of cultured vegetables and fermented foods while advising against hydrogenated oils. Cut back on refined carbs and sugar, and we advise patients to reduce their intake of refined carbohydrates and sugar. These dietary choices can predispose individuals to weight gain and exacerbate systemic inflammation, placing an additional burden on inflamed joints. Lifestyle interventions are such. We want to keep you moving. Recommend gentle movement techniques such as stretching, yoga, mobility, exercises, physical therapy. These activities can aid in maintaining joint flexibility and reducing pain and building muscle. Explore alternative therapies like chiropractic, which is number one for pain management. Also, physical therapy, acupuncture, massage therapy, and meditative movement practices like Tai Chi. These modalities can be particularly effective in promoting healthy pain responses during acute pain situations. We want you to prioritize sleep. We encourage proper sleep hygiene because disrupted sleep can stimulate the production of pro-inflammatory cytokines, exacerbating inflammation. Stress management is paramount because practicing stress management techniques can reduce chronic central and peripheral nervous system inflammation through the HPA axis. What causes acute inflammation? Acute inflammation is typically triggered by infections, injury, or tissue damage. It's a protective response aimed at eliminating harmful agents and initiating the healing process. Can chronic inflammation be prevented? While chronic inflammation can't always be prevented, adopting a healthy lifestyle, including a balanced diet and stress management, can help mitigate its effects. Are there any dietary supplements for managing inflammation? Yes. Supplements like fish oils, omega-3 fatty acids, and turmeric or curcumin have anti-inflammatory properties and can complement a healthy diet. How does chronic inflammation relate to age-related conditions? Well, I'm glad you asked that question. Chronic inflammation is considered a contributing factor in age-related diseases as it can accelerate the aging process and increase the risk of conditions like cardiovascular disease and arthritis. Is medication necessary for managing chronic inflammation? In some cases, medication may be prescribed to manage chronic inflammation, but lifestyle modifications, including diet and exercise, are fundamental in long-term management. Can stress worsen inflammation? Yes, stress can exacerbate inflammation. Chronic stress triggers the release of stress hormones that can lead to increased inflammation in the body. Our conclusion to understanding the pathophysiology of inflammatory disorders and pain is vital for effective management. By adopting a holistic approach that includes diet, lifestyle modifications, stress management, chiropractic, individuals can support healthy inflammatory responses and alleviate pain. It's crucial to address inflammation promptly to prevent its transition into a chronic and potentially debilitating state. Remember, the key lies in maintaining a healthy balance within your body's intricate immune response system. By doing so, you pave the way for a healthier, pain-free chiropractic lifestyle. Have a fabulous day. I'm Dr. Kim Carlucci.